Hi, Dave. I stumbled upon the Ask the Doc segments a couple of weeks ago, and it is very informative. Thank you. My question for Dr. Rand McClain is in regards to a side effect I am experiencing with TRT. I am soon to be 37 years old and was diagnosed with low testosterone a few years back. Before starting therapy, my total testosterone was 317, assuming nanograms per deciliter, and my free testosterone was 4.4, again, I'm assuming picograms per milliliter. I was prescribed 200 milligrams of tescipionate a week, along with 2 milligrams of anastrozole a week taken on different days, and 700 IUs of ACG a week. It doesn't say if that's punctuated or just one time a week. After a couple of months of therapy, my total test was 850. Okay, let me just comment while I'm doing this. But at what point after your last injection, which is very important, if you're taking thyroid, the doctor would say the same thing. Oh, it's a little high or it's a little low. When was your last tablet of Armour thyroid, let's say? So it doesn't give me a whole lot of information, but I'll keep reading. My free test was 18, and my estradiol was 13.2. Again, all these I need to know when the last injection was. I have noticed the testosterone makes my face puffy, red, and older looking. When I come off the testosterone, why would you want to come off the testosterone if you need replacement therapy? My face appears less bloated and youthful again. I switched to testosterone cream and it doesn't seem to have the same effect on my face. However, it just isn't as effective as the injectable, for sure.
Yeah.
And that's because when you're using the cream, there's a reason why you have to use it every day. Your testosterone levels are going up and down, and that's why every morning or every night, whatever it is, you got to put it on. Whereas with the injectable, it may be up and down during the week, but throughout the week it's high or lower than it was, but still always therapeutic. So that's an easy one. So that, yeah. Is there something I can do to counteract this effect? Is there another compound that I can take within a TRT dosage with less estrogenic side effects that is equal to or superior than testosterone that won't have the same side effect on my face? Okay. This may sound a little esoteric, but I'm going to throw it out there anyway. A couple numbers I don't have, which aren't esoteric at all, are your hemoglobin and hematocrit. So I don't know how long this gentleman has been, his name is John actually, I think, how long John has been on TRT, but if, for example, you have sleep apnea, or you have a defective, you have a JAK gene, which means you're going to make more hemoglobin and hematocrit than anyone anyway, or polycythemia rubra vera, then you may be exacerbating that condition by making more and more red blood cells, hemoglobin and hematocrit. So you're going to get a red face just because you got that many red blood cells that are oxygenated floating around in your body. And I see that often, okay? Now, sometimes, it activates the Celtic curse, which tends, rosacea. We don't know why necessarily, but sometimes just because of your eating habits, and this is where it gets a little esoteric, it can exacerbate rosacea, which makes your face red. Now, rosacea can, I would imagine, also make it so you look older too. I'm not sure what he means by that, but certainly testosterone gives you more of, what we call, I don't know a better way to say it, but a manly face. Bigger pores, rougher skin, as opposed to the sugar, spice, and everything nice face of a female, which tends to be smoother. And we've seen it with women who have used excessive amounts of testosterone. Oftentimes they take on the same features. So
rougher,
it's just, it's a little rougher. So if that's to which he's referring, well, that makes sense. Yeah, that's going to be part and parcel of this. Now, there's ways to counteract that. I mean, we've got now adult stem cell-derived creams that we can use topically to help make the skin more youthful. We've got, retin-A. We've got microdermabrasion. We've got all kinds of dermatological answers to this, including answers to rosacea, okay, that face redness. But the first thing I'd want to check is to make sure that the H&H, the hemoglobin and hematocrit, are not too high. Ask yourself before you even go in, hey man, is my wife or significant other complaining about my snoring at night? Or am I waking myself up, snorting or whatever, or just waking up and not knowing why you're waking up?
Yeah.
Because a lot of times you won't hear yourself snore until you're still too deep in sleep. So that's part, and it could be part of the problem. And I appreciate that. We all want to we want to feel youthful, but also look youthful.
Yeah.
The bloatedness, again, now, if this 13.2 estradiol was the day before he took his next shot of testosterone cypionate, or the day of, but before he took it, then there's no doubt in my mind that on day 2.5, where his testosterone levels peaked, okay, his estradiol was well above where we want it. Because remember, we're looking for estradiol to sit between about 15 to 20 picograms per milliliter. So that may be the problem. It's the excess estrogen is making him bloat, okay, and that's what's showing up in his face. And again, your puffiness relates to bloated and et cetera. So again, you got to do a little bit more investigating and paring these numbers down and fitting them into the box here to find out what's going on. Now, there is a group, it's a small group, but there are a bunch of people that say, oh, testosterone cypionate makes me bloated, but testosterone ananthate doesn't. I argue there's one carbon difference between an ananthate and cypionate, but I honestly, not being a smartass, I really have to acknowledge that, that's a beauty, that's a fun for me anyway of medicine, is that not everyone falls underneath that Gaussian curve, and you have these outliers every once in a while for physiological reasons we can't yet explain. Maybe try an ananthate, and maybe it does make a difference for you, where you don't get a bloat. Maybe there's something about the cypionate. Maybe it's just the excipient, the sesame oil versus grapeseed oil that makes the difference that you bloat with the cypionate. I don't know. But the other question you asked, of course, yeah, there are other things you can use other than testosterone. It's hard to get to do these days, but obviously, and I mean through a doctor.
Yeah.
But if you've got a problem with, first step would be, if you've got a problem with estrogen, you use the appropriate amount of, the AI or whatever you want to use. But to answer the question, obviously Anavar, oxandrolone, does not convert to estrogen, so that's one way. And I use it with women because it's an easy fix. You're using a very small dose. And all the stars have to align, but you've got someone who may be anorexic.
Yeah.
I've got a young gal who's anorexic and bulimic, and so we need a little bit more anabolism, but you don't have to worry about the oral effect because you're dealing with a couple 5 milligrams of an oral steroid. It's not going to have any risk on the liver that 40 milligrams, which I would still argue, quite frankly, even though it's in the books, I've never seen it affect the liver enzymes. 100, like how many people are using of Anavar, which I don't even know how they get through the day. I would think that would put you on another planet. Wow. Zing, like that kind of. Wow. But that I will see liver enzymes elevated. But I'm getting off track here. But a very small dose is safe. A larger dose, I would still argue, is safe, but not your best option. And I doubt you'd find a pharmacist would use it
for a man,
or would allow it. I mean,
what would be considered a small dose?
A small dose. I think if you read the literature, 20 milligrams is considered the low end of a replacement dose, and 40 milligrams is considered a high end of the replacement dose.
40, gotcha.
And in my mind, that would be more appropriate for, anything where you have an estrogen-sensitive anything, you got to worry about it. But again, you can use, and come on, man, that's expensive. I mean, again, from the standpoint of a hormone replacement doctor, not a bodybuilding coach, I'm going to talk to a patient and say, yeah, that's an option, even a female patient. But, if I'm not looking to put on meat because she's bulimic or anorexic or just any sort of weight-eating disorder, I say, why would you want to do that? It's so much cheaper just to use a testosterone cream and or even injectable. We have 20 meg per ml we can make, and just use a little bit of an anastrozole to keep the estrogen down. It's so much cheaper.
Yeah, that's a good point.
So again, to answer the question, I would look into, do you really have your estrogen governed the way you think you do?
Yeah.
Take your next assay, the next blood draw, and look at your assays for testosterone free and total and estradiol on day 2.5 after your injection, and see where you lie there. That might give us a lot of information. If that doesn't work, then you might be one of those that does better on an ananthate, which would give you almost the exact same half-life. It's 7 days instead of 8 days.
Yep.
And then with the red, there's so many things. Look into rosacea, the how well your GI tract is working, because there's a big link between overgrowth of bacteria in the GI tract and rosacea. And there's other ways to attack rosacea, but sometimes it does show up because of use of testosterone, but check your hemoglobin hematocrit first because you might need to let go of some blood. Again, I don't know how long you've been on this, John, and how long you may or may not have what we would generally refer to as sleep apnea. But if your oxygen saturation is dropping at night, whether it's because of heavy snoring, light snoring, or just whatever, it's not a matter of sleep time.
Yeah.
It's quality of sleep.
Right.
And it might be your H&H is too high, and you got to go donate some blood.
Boom.
And also then solve the problem of the sleep apnea.
There you go. Thank you, Doc.